Good morning, this is Dr. Berardi, and we're about to start a mastopexy on this patient. Typically, we're doing other procedures along with the mastopexy. However, today, just a mastopexy. So we'll talk about a few things. Typically, when I do my markings, we do it when patients are sitting up. That way, we can shape the breast because that's what we want to see, not when you're laying down, when you're sitting up. As gravity pulls down, it enables us to say how much hang does your tissue have, how much laxity is in your skin. So once I do the markings, we go to the OR and we'll check our marking. So what's the expression? Measure twice, cut once. So we're making some adjustments to her markings. Her skin is not quite as elastic as we want, so we made some adjustments to accommodate for that. So a great question that came to the practice is, can I control where we put the nipple with mastopexy? And where do we put it, and can I accommodate for patient requests? The whole point of a mastopexy typically is to raise the nipple or reposition the nipple. And typically as you age, your nipple will go down and further apart, which means when we do a mastopexy, the typical line in which we raise the nipple is higher and more toward the midline. In rare instances, for instance, last week I did a case where the woman's nipples were too close to the midline as she lost weight. And this is typically in a massive weight loss patient. So we varied our incisions to direct the nipple to a more lateral or further apart position so that nipple is centered on the breast mound. Typically nipple position, if you're looking in a mirror, your nipple should fall about the mid-third of your humerus. Some people with particularly long torsos or certain dimensions may need it to be higher, may need to be lower. It typically falls within norm. As far as requests to put the nipple one place or another, to be honest, I stick with aesthetic breast appearance. If it's going to be outside of that in the long run, patient's ultimately not going to be happy. So we talk about the norms and where that nipple should be. Okay, so we just finished with our mastopexy, and oftentimes we're combining the mastopexy with an augmentation. But with this gal, she said, I want to stay around the same size. I'm not interested in an implant. And she actually had a decent amount of breast tissue to match her body habitus. So when I tell people, okay, with a mastopexy, we're going to lift your breast, and you will actually lose some breast volume with a mastopexy. One, you're losing excess skin. And two, there's also sometimes some shaping where we'll take away some breast tissue to optimize the overall outcome. So mastopexy is a fantastic procedure. And yes, you can lose a small amount of volume after the fact.